What's good with it? YouTube Veterans Military back again with another banger. Big update when it comes to updates to the VA schedule of rating for digestive issues. 55 disabilities are being updated right now, taking effect in May 2024. You like this type of content? Let your boy know. Like the video if you learned anything or you gain anything from this video. Comment, share. And let's get into it. Let's jump into it. So we got the schedule for ratings, disabilities, the digestive system. On January 11th, 2022, it was a proposed rule that was submitted on behalf of the VA to modify all VA ratings under the digestive system. I did do a video on this a couple of months ago. Majority of y'all seen it. Majority of y'all just been eating up that clickbait. But let's get back into it. VA received only 22 comments. 22 comments. What did I say? This is what the VA expected. The VA expected for a low amount of veterans to actually read the proposed changes and make a comment. 22 out of how many? I think 18 million veterans. 30% of that are currently receiving VA disability compensation or benefits, responded to these proposed changes. So whatever proposed changes are coming, whether it be good or bad, and I did some reviewing, but it seems like they're cracking it down. They're cracking it down on GERD, IBS, and a couple other things. So let's jump back into it. So the first change we got is the new VA rating updates for GERD, aka gastroesophageal reflux disease. And right off the back, hey, now we got an 80% VA rating criteria. Whole criteria, everything's changed with this. So we start at the top. In order for veterans to get 80% documented history of recurrent or refractory esophageal stricture causing dysphyxia with at least one symptom presenting: 1. Aspiration, undernutrition, or substantial weight loss as defined by the CFR 38 4.1112. There you go. And treatment with either surgical correction or esophageal stricture or with PEG tubes. Cool. 50%. Documented history of recurrent or refractory esophageal stricture causing dysphyxia. So now it's a requirement, which requires at least one of the following: dilation 3 or more times a year, dilation using steroids at least 1 time per year, or 3 esophageal stent placements. That'll get you 50%. For 30% VA rating, documented history of recurrent esophageal stricture causing dysphyxia, which requires dilation no more than 2 times a year. Cool and Gucci. Moving on to the 10% VA rating criteria. There's going to be documented history of esophageal stricture that requires daily medication to control dysphyxia, otherwise asymptomatic. 0% documented history without symptoms or requiring for daily medication. Okay, cool. Now, the dude got a lot of notes on this. Note 1. Findings must be documented by barium swallow, computerized tomograph, or esophageal endoscopy. You know what I'm talking about? Hey, I'm not a doctor. If I mispronounce a word, roll with it. You know what I'm talking about? Go to Google, type in pronunciation, and there you go. Moving on. Note 2. Non-gastrointestinal complications of procedures should be rated under appropriate system. So they have modified a couple of things on this in order to separate disabilities, so it's not pyramiding, it's not stacking, it's not being blended, or it's not being misunderstood, if that makes sense. Note 3. The diagnostic code applies, but not limited to esophagitis, mechanical or chemical, Mallory-Weiss syndrome, bleeding at the junction of the esophagus and stomach due to tears, due to caustic ingestion of alcoholic. I'll give you a minute just to, you can screenshot this, read this later, or, you can always check it out on the website. Moving on from there. And then we got note 4. Recurrent esophageal stricture is defined as the inability to maintain target esophageal diameter beyond 3 weeks after the target diameter has been achieved. Cool. Note 5. Refractory esophageal stricture is defined as the inability to achieve target esophageal diameter despite receiving no fewer than 5 dilation sessions performed at 2-week intervals. Moving on from there. Now we got the new VA rating updates for peptic ulcer disease. This award is anywhere from 0 to 100%. So if it applies as a direct or secondary VA disability, by all means, veterans, get the diagnosis, get the medical evidence needed because the VA is getting a lot more detailed with these disabilities. 100% post-operative for pre-formation or hemorrhage for at least 3 months. 60% VA rating. Continuous abdominal pain with intermediate vomiting, recurrent hematosis, vomiting in the blood, or tarry stools, and manifestations of anemia, which requires hospitalization at least once in the past 12 months. 40% criteria. Episodes of abdominal pain, nausea, vomiting that last for 3 consecutive days in duration, occurring 4 or more times in the past 12 months, and are managed by daily prescribed medication. 20% episodes of abdominal pain, nausea, and vomiting, same thing as before, lasting for 3 consecutive days in duration, occurring 3 times or less in the past 12 months. So the difference between 20 and 40% is 40% 4 more times in the last 12 months, 20% 3 times or less in the last 12 months, still being managed by prescribed medication. And for 0%, a history of peptic ulcer disease documented by endoscopy or diagnostic imaging studies. Moving on from there, veterans. New VA rating updates for IBS, Irritable Bowel Syndrome. This is a big ticket item. A lot of veterans have been getting 10 to 20% for this, 10 or 30%. Now, the VA has introduced a 20%. So, the VA has now introduced a 20% criteria. Biggest change for IBS is going to be the VA got rid of a 0% VA rating as well as added 20%. So, they exchanged 0% for 20%. So, as long as you have IBS diagnosed either on direct or your medical evidence can support causation to a secondary disability, now you can get 20%. Now, those are the biggest changes, as well as the actual criteria needed in order to get a higher VA rating. So, starting out for 30% for IBS. Abdominal pain related to defecation at least 1 day per week during the previous 3 months, or 2 or more in the following. Change in stool frequency, change in stool form, altered stool passage, straining, or urgency. Mucorrhea, abdominal bloating, or subjective distension. For a 20% VA rating, abdominal pain related to defecation for at least 3 days per month during the previous 3 months, or 2 or more of the following. 2 or more of the following. You don't need everything, just 2 or more. Minimum 2. Change in stool frequency, change in stool form, altered stool passage. Mucorrhea, abdominal bloating, subjective distension. For 10%, abdominal pain related to defecation at least once in the previous 3 months, or 2 of the following, same thing I've already said. And obviously, for all these disabilities, you're going to need a diagnosis you're going to need a diagnosis for a direct service for anything under the PACT Act, Vietnam era veterans, Gulf War era veterans, whatever the case may be. Now, if you're trying to file secondary, you got to show what causation. How is tinnitus causing IBS? My IBS gang is over there. Staying swole with it on them porcelain walls. Y'all know what I'm talking about. VA rating updates for Crohn's disease, as well as other forms of inflammatory bowel disease. Anywhere from 0 to 100% VA disability rating, depending on your severity of symptoms. And if y'all want a side-by-side, let your boy know. That's going to take a little bit more time, but if y'all do want a side-by-side comparison of current VA rating and what's to take into effect, pretty much these in May of 2024, so we're about 60 days out. Let your boy know in the comments. Let's get back into it. Severe severe inflammatory bowel disease that is unresponsive to treatment and requires hospitalization at least once per year, and it results in either an inability to work or is characterized by recurrent abdominal pain associated with at least two of the following: 6 or more episodes per day of diarrhea, 6 or more episodes per day of rectal bleeding, recurrent episodes of rectal inconsistency, recurrent abdominal distension. 60%. Moderate inflammatory bowel disease is managed by an outpatient basis with immunosuppressants or other biologic agents, and is characterized by recurrent abdominal pain 4 to 5 times daily, of diarrhea, and intermediate signs of toxicity, such as fever, diarrhea, or anemia. 30%. Mild to moderate inflammatory bowel disease is managed with oral or topical agents other than immunosuppressants or other biologic agents, and is characterized by recurrent abdominal pain with 3 or less daily episodes of diarrhea and minimal signs of toxicity, such as fever, that T word, because I ain't a doctor, or anemia. Moving on. 10%. Minimal to mild symptomatic inflammatory bowel disease that is managed with oral or topical agents other than immunosuppressants or other biologic agents, and is characterized by recurrent abdominal pain with 3 or less episodes daily of diarrhea and no signs of systemic toxicity. With some notes. Note 1, following a colectomy or colostomy, and doctor, hopefully I'm saying that right, with persistent or recurrent symptoms, rate either under diagnostic code 7326 or diagnostic code 7329. Intestinal large resection of performs the highest rating. Note 2, VA requires diagnosis under diagnostic code 7326 to be confirmed by endoscopy or radiologic studies. So now it is an absolute must for veterans to have this diagnosed under this specific criteria, and it's pretty much for all these new disabilities. You need this specific diagnostic code in order to get service connected, and then you'll move on from there, as long as your medical evidence supports direct or secondary basis. Note 3, inflammatory may involve small bowel, large bowel, or inflammation of any component of the gastrointestinal tract from the mouth to the anus. Baby. And that's about it for this video. Like I said, there are 55 different disabilities. I'm not going to do all 55. I will do the most prevalent disabilities that veterans file VA disabilities for. They're seeking them. High demand VA disabilities. High demand VA ratings. But if you got specific, leave it down in the comments down below. If you're currently in the process, hey, hopefully you've already done your CMP exam prior to this change taking effect. If not, if you're still in the process, you haven't submitted a claim, or you're still building medical evidence, and you don't think you're going to have this medical evidence submitted by May 2024, I definitely implore you, read through these changes. The CFR 38 will be updating. The DBQs, Disability Benefits Questionnaires, will be updating. It'll behoove you. It's going to be in your best interest to take a look at that. Make sure you're going in there with the specific diagnostic codes. You're going to need these diagnostic codes in order to get service connected. After May, the VA is not going to be like, oh, we're going to give you a bone. No, you don't have this specific diagnostic code. You're not going to get this rating. You're not going to get service connected. If you don't meet this new criteria, we're going to give you a 0%. You may have the diagnostic code, but you don't have the specific correct and right criteria in relation to these new changes that are going to be taking effect in May of this year. Like I said, hey, y'all like the learning? Y'all like the information? By all means, stop by, like, share, subscribe. Comment down below your personal thoughts on this opinion. And until next time, this motherfucking D-Ball, y'all stay Gucci with it.